Dr. Cindy Hodgson with Essential Therapies here, and we are going to talk about some self-myofascial release for your tennis elbow, or whenever you're having anything aching here, or maybe you're not playing tennis, but you're getting some elbow pain and no one can figure out why you're still having it. So I want to talk about this area here. So many of the patients that I've worked on with tennis elbow or other elbow problems have a lot of tightness in this area. This could be caused from many things, not just tennis, right? Maybe there's a lot of mouse use or other types of gripping. For me, I experience this as well because I'm using my hands a lot for hours at a time and really activating this muscle group. So I have, of course, I'm using both arms, but I'm really right dominant and I have a tendency to use this arm a lot more. So if you were to take your hand and just feel both sides and actually grab the tissue here. So you can see I'm actually moving this tissue. When I move this side and squeeze it and kind of feel it, ooh, it's really thicker up in here and much harder compared to over here. I kind of burned myself there the other day on the wood stove. And when I do this, I can actually feel that both sides have some tightness in them, really, but this right side is significantly tighter. So when I find an area, I'm gonna take my fingers into it and just press, take up the slack, and I'm kind of scooping that tissue away from the bone, and then I'm squeezing it with this hand. So with myofascial release, using the John F. Barnes myofascial release approach, we are taking up the slack in the tissue and we are waiting. And the key thing is that we wait long enough for that tissue to change. So here's the thing though, you really have to watch your time because so many times you can be holding something or waiting. Have you ever been waiting for maybe a spot at the grocery store to get out in the line and you know, you think you're waiting there forever because you're impatient and you need to go do something and it's really only been a minute and a half or 2 minutes and it feels like you've been there for 10. We've all been there, right? In one way or another. That's what happens here a lot of times. So it's really important for you to watch the clock. And here's the thing, if you were to move your arm or like switch positions or change your hand a little bit, you gotta start the clock all over again. So really get a comfortable spot, support yourself in whatever way you can and hold it there. Now, maybe you can't use your other hand to do this. You can also use tools in this area as well. One of the things that works well is a small jar, like the size of a spice jar. I've used that before to be able to kind of roll that back and forth and not rolling it as the activity, but roll it till you feel a good spot and then leave it there. You can also use small balls. So something the size of a tennis ball that might even be softer than that, or we have various size balls with just air in them, rubber balls that maybe are not super hard, but they provide some pressure. But be creative. You can use all kinds of different things. I have even used other parts of my body before. So here I am pushing into this. I feel that pressure and it's taking up the slack in a good way. So if I stay here long enough, I will also get a release in this position. So be creative in ways that you can push into this area. So that's one way, you directly working on that tissue. Because here's the thing, here's the tightness, and that pulls all the way up into the elbow area. So you may have some lateral or even medial elbow pain, and that is where you have the pain. That's the symptom, but the cause could be down here further. Now, the cause could also be up higher, so there may be a lot of tension in your shoulder. So if you do this stretch here, where you take your arm against the wall, and I like to really straighten out my fingers, and then position your body so that you're getting a stretch in here, and you can actually see how this is getting into all this musculature here, and I have a lot of tightness into the pec and into the neck, and then you can add the neck as well. Turn and angle it. And where your tightness is going to be unique to you. So play around with that positioning. And once again, you're going to be holding it for a good 5 minutes. So 5 minutes is where the collagen fibers in the fascia begin to change. They begin to lengthen, and that's what we need to do, is lengthen that tissue. So at least 5 minutes, longer if you can. One of the things that I also do in my car, because I drive in the country a lot, so I don't have to worry about a lot of traffic, is I'm able to put my arm behind the passenger seat, and it's my right side that's the most symptomatic. So I put my arm there and I actively extend those fingers and my wrist, and I do this on my way home from work, and so I leave it there for several minutes, usually 5 to 10 minutes, and I feel an absolute difference in just that one activity of putting my arm behind the chair. So those are a few things that you can do on your own. Now the thing is, a lot of times you can't really get to that problem just by doing it yourself. You really need to have some work. You need someone who's skilled to really get in there and work those areas enough to really make a change. So a lot of times we think, gosh, it would be great if we could just do one treatment and everything is done and it's better. But usually there's a lot that goes into creating that tightness. It's not just one moment or one event that created this myofascial restriction or this restriction in whatever tissue that you have in your body. So it takes some work and some consistency. So even if you're getting treated, it's really important to continue to treat yourself at home for the best results. So give that a try and loosen up the tissue around the elbow, above and below. Good luck.